A 22 years old man is referred to surgical clinic. He has been complaining of varicose vein for many years. On examination, he has extensive varicositis of the right leg. There are area of marked port wine staining. The saphenofemoral junction is competent on Doppler assessment. What is the most likely underlying cause? So patient goes to the surgical clinic, and there the findings are extensive varicositis of the right leg. Second one, marked port wine stain, and third one is the saphenofemoral junction is competent. So what may be the diagnosis? Here the options are the deep vein thrombosis, Klippel-Trenaunay syndrome, varicose vein due to saphenofemoral junction incompetence, Sturge-Weber syndrome, angiosarcoma. So what may be the cause? First of all, let's see the Klippel-Trenaunay syndrome. What is Klippel-Trenaunay syndrome? Klippel-Trenaunay or Weber syndrome generally affect a single extremity. So this is one of the important point, that Klippel-Trenaunay syndrome, it affects single extremity. Although cases of multiple affected limb even have been reported. In some cases there may be multiple, but this is very rare. The leg is the most common site, followed by arm, trunk, head and neck. So the leg is the most common site, then arm, then other area. Here we can see the Klippel-Trenaunay syndrome, and here first of all let's see, this is the port wine stain which present from the birth. That means this birthmark which is port wine stain. Here the stain is port wine. The second, there is the varicose vein, and there is a soft tissue and bone overgrowth. So soft tissue, bone overgrowth, varicose vein, port wine stain, they are the feature of the Klippel-Trenaunay syndrome. And also here we can see the foot swelling. Why foot swelling? Due to lymphatic malformation. Now see the sign and symptom. The birth defect is diagnosed by presence of combination of this symptom. That means the Klippel-Trenaunay syndrome, it is birth defect and present from the birth. One or more distinctive port wine stain are sharp borders, varicose vein, hypertrophy of the bone, soft tissue, and that may lead to local gigantism or shrinking, and improperly developed lymphatic system. So what are the sign of symptom? The sign and symptom, first of all, port wine stain which present from the birth, varicose vein, bone and soft tissue swelling. These are the feature of the Klippel-Trenaunay syndrome. And in some cases port wine stains may be absent. In some cases port wine stain not present, and these are known as the atypical Klippel-Trenaunay syndrome. Are showing the different area of the leg and present the Klippel-Trenaunay syndrome, port wine staining. Here first of all, this is front view, this is lateral view, and this is the posterior view. So what is our diagnosis? Our diagnosis is the Klippel-Trenaunay syndrome. Why Klippel-Trenaunay syndrome? Because first of all, there is a varicose vein, but it is not most important. The most important is the port wine stain. And the third one is the saphenofemoral junction is competent. That means there is no incompetency. So our answer is the Klippel-Trenaunay syndrome. And the deep vein thrombosis, it is not true. Why not? Because in the here we can see the Doppler done. So in Doppler, if there was thrombus, it is clearly identified. Varicose vein due to saphenofemoral junction incompetence, it is also not true, because here we can see this is the competent. And angiosarcoma also not true, because the angiosarcoma, it is the tumor of the blood vessel. So our answer is the Klippel-Trenaunay points. The important points are, first of all, the port wine staining, second one varicose vein, then bones and soft tissue hypertrophy, and also there is the lymphatic malformation. These are the feature of the